Hey, good morning, everybody. It's Manny Moustakakis coming to you from my house in Long Island. I just wanted to continue with the theme of Go Red for Women, which I started with a video on Friday. And I decided I wanted to talk a little bit about the risk factors for heart disease, and particularly those that affect women. Number one, today I decided I want to take a few minutes to discuss diabetes, which is a major risk factor for a lot of things, including heart disease. And so I'll break it down into a few topics that hopefully will just take a few minutes to discuss. Number one, the different types of diabetes, the different risk factors associated with it, the disease processes that it's associated with, how you can find out more about it, and last I'm going to spend at the end of the video going to talk a little bit about 5 strategies that you can employ to reduce your risk of diabetes. So jumping right in, what is diabetes and what are the 2 different types? Diabetes is basically your body's inability to metabolize sugar, and that's a bad thing because it affects basically every organ from your head to your toe. Type 1 diabetes is typically a situation where your body just can't produce insulin. That differs from type 2 diabetes, which is sort of known more as the adult onset, although we see it a lot in adolescents too these days. Type 2 diabetes is the inability of your body to metabolize insulin. Your body becomes resistant to insulin, and so sugar levels tend to rise. What are the risk factors associated with diabetes? Number one is a family history of diabetes is maybe the most important one, along with obesity and being overweight. Certainly with the increase in obesity in the United States, there is an increased incidence in the development of type 2 diabetes. Physical inactivity is another major risk factor, high blood pressure, and some ethnic backgrounds, most notably South Asian population has a 6 times level of incidence of type 2 diabetes, and also anyone from African and Afro-Caribbean backgrounds have as much as 3 times the incidence of type 2 diabetes. So what are some of the signs that you might see? Some of the signs of diabetes, and this can be pretty vague, which is why sometimes it's a problem, but typically you'll hear of things like excessive thirst, frequent urination, increased hunger, and lack of energy, a lot of fatigue. And if those symptoms sound really vague, that they are pretty vague, and that's probably why it's estimated that half of all adults who have type 2 diabetes are undiagnosed. And in my line of work, that comes into play sometimes, because a lot of times people's first diagnosis of diabetes comes when they're hospitalized for something else. And what are some of the things that diabetes does? How does it attack your body? Well, in my line of work, it is absolutely a leading cause, if not the leading cause, of heart disease and heart failure, coronary disease, heart attacks for sure, a major risk factor. Probably at least 1/3 of the patients that I work on have type 2 diabetes. Number 2 leads to a lot of circulation problems, peripheral disease, circulation with blockages in the arteries in the legs, a leading cause of amputations, a leading cause of kidney disease, one of the major causes of kidney failure and kidney dialysis, the need for dialysis. Diabetes attacks the kidneys. It is a leading cause of strokes and vascular disease in the head and the brain, a leading cause of blindness and nerve damage. And last, diabetes is a major risk factor for pregnancy complications. So it basically does attack everything from head to toe, not just hearts and heart attacks and heart disease, and not just women, but its incidence is increasing in women. So, what are some of the things that, if I just wrap up at the last couple of minutes here, what are some of the things that you can do to reduce your risk of developing diabetes? Well, number one is go to your doctor, because I already talked about how the signs and the symptoms can be really vague. Some people don't feel anything at all. So the best thing you can do is just go to your doctor and know your blood sugar levels. Blood sugar is a standard blood test that is part of any initial exam and initial lab series with any doctor. So just going to your doctor is probably the best thing you can do. In terms of actual prevention, so 5 things that you can do to prevent or minimize your risk of developing diabetes. Number 1, regular exercise. So as much as 30 minutes a day, or as little as 30 minutes a day, for several days a week of regular aerobic activity. What does that do? Regular exercise reduces your body's insulin resistance. It just makes it easier for your body to metabolize sugar. Number 2, smoking. Not to start, but to quit. Smoking increases the levels of abdominal fat and insulin resistance, and abdominal fat is clearly a major risk factor for developing diabetes. Number 3, stress. You know, I always tell people that it's hard to quantify stress and it's hard to describe the impact of stress, but in general we know from a lot of studies that stress is a very bad thing, whether that's for heart disease or for developing diabetes. Number 4, sleep patterns, inadequate sleep, and actually prolonged sleep. So as little as people with less than 6 hours of sleep a night or people with longer than 9 hours of sleep a night, there are studies that show that particularly inadequate sleep will raise your level of diabetes. And then last is basically nutrition, diet and nutrition. We know that complex carbohydrates, high fat and high complex carb diets will increase your risk of diabetes, whether that's because it increases abdominal obesity or insulin resistance. Is not always most clear, but definitely those things do not help. But protein rich diets, high fiber diets, and a lot of vegetables in your diets, all of those things can help minimize your risk of developing diabetes. And that's pertinent when we talk about the levels of obesity in this country and the rising rates of adolescent obesity and adolescent development of type 2 diabetes. It's a problem that's getting worse, not better. Today is Super Bowl Sunday in the United States, so there's a lot of Super Bowl parties happening, there's a lot of eating happening, and it's tough when you talk about food in general, because food, you know, I've always maintained is sort of part of the fabric of society. It's not something that you should feel punished about, in my opinion. It's something that you got to just work to plan with and plan around. I'm not one who ever really employs a strategy of strict dieting or unreasonable dieting demands. You just have to be sort of smart about the portions that you eat and the types of foods that you eat, and that can go a long way towards helping maintain weight loss and helping minimize your risk of developing diabetes. So to everyone in the United States who's going to a Super Bowl party today, enjoy it, be smart about it, enjoy the game, enjoy the party. Food is meant to be fun, and parties are meant to be fun, so go out and have a good time. And thank you guys for watching, and I hope you got something out of this video. I hope to, in the next couple of days, do another risk factor. Next one will, well, I don't know which one I'm going to do next. Maybe smoking. But anyway, I hope you guys got something out of this, and enjoy the rest of Super Bowl Sunday, and have a great day, everybody.